I had my scheduled ultrasound to check gender and anatomy and make sure everything was growing correctly, and all the reports, our ultrasound person said everything was fine, baby was looking great, and we found out it was a girl, and we named her Noelle Renee, and after mommy, Alicia Renee, and we just finally felt like we could breathe again, like finally, we're having a normal pregnancy. I told him I felt like we could finally enjoy the pregnancy, and woke up at 3 a.m. the following morning, and there was just fluid coming out of me. Our perinatologist said that in 75% of cases of PPROM, the preterm premature rupture of membranes, that with 75% of them deliver within 2 weeks, which would have been prior to the age of viability for our little one. So not much that can be done at that point to save the baby's life.
The goal is to get them to 34 weeks. There's a lot of data that shows after 34 weeks, babies tend to do fairly well. They have less morbidity or illness because of prematurity. And before 34 weeks, they tend to have a little bit more problems with their lungs and needing to stay in the NICU a little bit longer.
They said at 23 weeks, if I was still pregnant, and they would take me up here, and I would stay up here until the baby was born. So we almost made it to 23 weeks. At 22 and 5, which was Friday the 14th, I woke up and that 7 centimeters of fluid I had built up came out. And I just started leaking a lot again. And we called our doctor, and she said to go ahead and head on up this direction.
When women have preterm rupture of membranes, they're at increased risk for infection, so we put them on antibiotics for a week to help decrease the risk of infection. Because they have that risk, we keep them in the hospital, and also because she continued to have a small amount of bleeding intermittently, we want to monitor her so that if at any point she develops an infection or starts bleeding more heavily, then we know that we need to go ahead and get her delivered.
This time around, they were worried that my placenta was starting to erupt because of how much fluid I was losing and the color of the fluid. So they came in and they said, "We need to take you now."
Noelle was pretty sick the first day of life, and she has steadily had improvements every day since. The high mortality associated with someone who has Noelle's history, a mom whose membranes broke at 20 weeks gestation, and that was not, at one point in time, not considered survivable. And that is a testament to what we can do with our current care plans for babies who have pulmonary hypoplasia. Her lungs will continue to develop, and that's one of the great things for babies who are born prematurely, is time and good nutrition and growth is in their favor. This is exactly the type of mom and baby that we want to take care of, because we have the technology and the medications available to optimize treatment after birth.
Their level of attentiveness to the patient. They don't just take care of you physically, they're taking care of your questions and emotionally, because they understand that that's an important part of your health as well. And not only that, you can tell that there's a high level of care here just by the answers to the questions that you get and the type of equipment and staff that they have here. You can tell it's really top-notch.
In women who have preterm rupture of membranes, especially that early in pregnancy, it's very important to have them at an academic center with a neonatal intensive care unit, so that the maternal fetal medicine team, as well as all of the residents, can take care of the patient, and then also knowing that the neonatal intensive care unit with all the neonatology staff is pretty much right down the hallway. It's very important when babies are born this early, or even have a risk of being born at 23, 24 weeks, or even before 30 weeks, that they're in an institution that can care for them immediately.